early signs of colon cancer that are always ignored. Did you know that colon cancer is often dubbed the silent killer? It's because this disease can sneak up on you without warning signs until it's too late. In the United States, over 100,000 new cases of colon cancer are reported every year. Shockingly, nearly 50,000 people die each year from this disease. Although it's important to predict for sure whether someone will develop colon cancer, certain early symptoms may indicate a potential issue. Some of these indicators may be subtle, while others are more noticeable. It's important to note that the content discussed in this video is impartial, verified by qualified healthcare experts, and reviewed for accuracy. So, without further ado, let's delve into the 9 early signs of colon cancer. Starting with a symptom that may be mistaken for diarrhea. Number 1. Changes in bowel habits. While this disease is typically diagnosed in individuals over 60 years old, it can affect people of all ages. In fact, statistics suggest that younger people are also at risk. A healthy colon usually results in regular bowel movements every day or two. The stool should be soft, brown, and easy to pass with no traces of blood. But if you're noticing any changes in your bathroom routine, such as infrequent bowel movements or difficulty passing stool, it could be a red flag to look out for. Keep in mind that catching colon cancer early can be crucial to successful treatment, so don't hesitate to seek medical advice if something seems off. Next is another symptom that could be a sign of a harmless condition. It could also be an early symptom of colon cancer. Number 2. Unexplained abdominal pain or bloating. Did you know that genetics and lifestyle choices can increase your risk of colon cancer by up to 30%? Poor diet, obesity, smoking, and alcohol are just a few factors that can increase your risk. In fact, genetics account for up to 15% of all cases of colon cancer, while lifestyle factors account for up to 10% risk increase. But back to bloating. It's actually one of the most common symptoms of colon cancer, even in the early stages of the disease. Bloating is often characterized by a feeling of fullness or swelling in the abdomen, which can be caused by gas, certain foods, or medications. To reduce bloating caused by overeating, try eating smaller meals more frequently throughout the day. This can also help control blood sugar levels. Remember, if you're experiencing unexplained bloating or abdominal pain, it's important to speak with your healthcare provider to find out the underlying cause and receive proper treatment. Now let's talk about feeling constantly tired, another symptom that can be associated with colon cancer. Number 3. Fatigue. While feeling tired can be attributed to many factors such as staying up late or not getting enough sleep, it's important to pay attention to any changes in your energy levels. When the colon is blocked or functioning improperly, waste removal is affected and toxic buildup can occur in the digestive system, potentially leading to cancerous tumors in the colon. In fact, feeling tired more often than usual combined with other symptoms like bloating or abdominal pain could be an early sign of colon cancer. According to a study published in the Journal of Cancer Survivorship in 2016, fatigue is a common symptom among colorectal cancer survivors, affecting up to 40% of patients even after treatment. Also, a research published in the journal Cancer Epidemiology, Biomarkers and Prevention in 2014 found that fatigue was associated with an increased risk of colorectal cancer among postmenopausal women. However, feeling tired can also be a symptom of many other conditions, so it's important to see a doctor for a proper diagnosis. Did you know that losing weight can be an early sign of colon cancer? Number 4 is weight loss. While shedding a few pounds might be a cause for celebration for some, sudden and unexplained weight loss can be a potential red flag. If you're an older adult who has recently overcome an illness, it's normal to experience some weight loss. But if you've lost more than 10 to 15 pounds over several months without making any significant lifestyle changes, it's time to pay attention. In fact, sudden weight loss is one of the early signs of colon cancer, as well as other gastrointestinal diseases. Here's a fun fact. Did you know that up to 40% of cancer patients experience unintended weight loss at the time of their diagnosis? While it's not always an indicator of cancer, sudden weight loss should always be taken seriously and discussed with a healthcare professional to determine the underlying cause. So, if you're experiencing unexplained weight loss, Don't hesitate to visit your doctor for further evaluation. Did you also know that diarrhea could be a potential sign of colon cancer? Number 5 is diarrhea. Diarrhea is the passage of 3 or more unformed stools within a 24-hour period. While this condition is often associated with other gastrointestinal issues like irritable bowel syndrome or inflammatory bowel disease or even lactose intolerance, it can also be a symptom of colon cancer. According to the National Cancer Institute, some people may experience diarrhea as a result of bacterial or parasitic infections in their colon. According to the Centers for Disease Control and Prevention, CDC, diarrhea affects around 179 million Americans each year, leading to roughly 1.5 million hospitalizations and 30,000 deaths. While it's usually a minor inconvenience, if you're experiencing chronic diarrhea or sudden changes in your bowel movements, it's important to see your doctor to rule out underlying medical conditions, such as colon cancer. Don't take chances with your health. Here's another fact about colon cancer. Did you know that colon cancer is actually super treatable if caught early? In fact, the 5-year survival rate is a whopping 95%. But here's the not-so-fun part. About 5% of Americans will develop colon cancer in their lifetime. That's 1 in 20 Americans. Number 6 on our list is blood in your stool. While blood in your stool may not be the most glamorous topic, it's important to know that it can be an early sign of colon cancer. The colon is like a storage unit for our poop, and sometimes things can get a little too crazy in there. Bloody stools can be caused by a variety of things, such as inflammation, injury, or bleeding in the large intestine. It's not always a sign of cancer, but you need to talk to a doctor if you notice blood in your stool. Don't be afraid to ask about potential causes, such as certain medications or medical conditions like hemorrhoids, ulcerative colitis, or diverticulitis. Remember, early detection is key to colon cancer treatment and increasing the chances of survival. Sometimes things can get a little backed up when the colon, the unsung hero of our digestive system, is affected and resulting in the dreaded C word, constipation. It could be colon cancer. Number 7 is constipation. The colon plays a vital role in eliminating waste from our body and absorbing water and nutrients from the food we consume. However, it can become obstructed, leading to constipation, which is uncomfortable and potentially embarrassing. Although constipation may not initially seem like a significant problem, it can be an early indication of colon cancer. According to research, over 80% of colon cancer patients reported experiencing constipation before their diagnosis. Constipation can be caused by various factors like medication, side effects, and a lack of physical activity. It may be challenging to differentiate normal constipation from more severe conditions like colon cancer. If you have constipation that lasts for over 3 days or other symptoms like bloody stools and abdominal pain, consult your doctor. The rectum might be at the rear end, but if you pay more attention to it, it could save you from cancer. Number 8. Rectal bleeding. According to a research paper published in the American Journal of Gastroenterology, rectal bleeding is a common symptom of colorectal cancer. The study found that rectal bleeding is more likely to be caused by benign conditions. In addition, a research paper published in the Journal of the National Cancer Institute found that people who experienced rectal bleeding were more likely to be diagnosed with advanced stage colorectal cancer than those who did not experience this symptom. The rectum is the last part of your large intestine, which is about 5 inches long. It's where waste leaves your body. If you experience bleeding from the rectum, it could be a sign of colon cancer. But don't panic just yet, because most people with this symptom don't have colon cancer. There are other culprits like pesky hemorrhoids or anal fissures, which can cause rectal bleeding too. So if you notice any red flags, it's best to consult your doctor. And if you've enjoyed this little chat about your backside, give us a thumbs up and hit that subscribe button for more fun and informative videos. Indigestion? It might be time to check your digestive tract. Number 9. Feeling full all the time. There have been several studies on the link between feeling full all the time and colon cancer. A research paper published in the British Journal of Cancer found that individuals who reported feeling full after eating small amounts of food had a higher risk of developing colon cancer than those who did not experience this symptom. Another study published in the Journal of Gastrointestinal Oncology found that patients with advanced colon cancer often experience symptoms such as abdominal distension and early satiety, feeling full all the time. due to the tumor blocking the intestine. These findings suggest that colon cancer can cause bloating, constipation, diarrhea, and other tummy troubles that make it hard to enjoy your favorite foods. Plus, a healthy diet alone might not be enough to prevent colon cancer. Exercise is key. But don't worry, feeling full doesn't automatically mean you have colon cancer. In fact, most people with this symptom don't have the disease. However, if you're experiencing persistent bloating and other digestive issues, it's important to talk to your doctor. Early detection of colon cancer is crucial for successful treatment and long-term survival. So, hit the gym and schedule that checkup to stay on top of your colon health. Sometimes people may overlook symptoms like weight loss or fatigue and not seek treatment because they think it's caused by something else. However, it's important to remember that eating healthy, exercising regularly, and maintaining a normal weight can help prevent colon cancer. By doing so, you can help keep your colon clean and healthy. If you have a family history of colorectal cancer, especially if 1 or 2 first-degree relatives were diagnosed before the age of 55, you have a higher risk of having the disease and should talk to your doctor about screening options. Research has shown that maintaining a healthy lifestyle can significantly reduce the risk of developing colon cancer. For example, a study published in the Journal of the National Cancer Institute shows that regular physical activity can reduce the risk of colon cancer up to 25%. Another study published in the same journal shows that a diet high in fiber and low in red and processed meats can lower the risk of colon cancer by up to 40%. Additionally, early detection through regular screenings, especially for individuals with a family history of colon cancer, can increase the chances of successful treatment and survival. In the United States, African Americans are at a higher risk of developing colon cancer compared to other racial and ethnic groups. But this may be due to limited access to screening tests rather than solely biological factors. Please seek medical attention immediately if you experience any of the symptoms mentioned earlier, as they could be early indicators of colon cancer rather than conclusive evidence. Moreover, if you have any of the risk factors for colon cancer as mentioned before, it's recommended to discuss with your doctor whether colonoscopies are the best screening option for you. Thank you for being so patient up to this point. It is greatly appreciated. Subscribe and enable alerts to avoid missing out on future videos from us and more. Check out this video to learn more about how to care for your body, and we'll see you in the following video. Stay safe.